I've had this suffering for 8 years. You never could afford it.
So for Ms. Gloria here, she's been having difficulties with her partials and her upper denture for about 8 years now. She's got a bony spicule in her upper right maxilla that has been irritating and causing her pain for some time now. So what we'll do is we'll just raise a little envelope flap above the bone there and smooth down that bone for her and then close everything. And then on the lower she's got a retained root tip that's irritating the soft tissue and bothering her as well. So we'll go ahead and remove that and hopefully cure her of her 8-year difficulties. So.
When I got here at 1 o'clock, there was already 12 people here ready to get some work done. Got talking to them about 9:30 p.m. last night is when the first set of people got here, and they've been here ever since. And right now, I was checking my list, we're up to about 74 people signed in.
This will probably be like the first time ever getting tooth pulled. And I am 39 years old.
Thomas had a very difficult extraction. He had tooth number 16, which was a full bony impacted wisdom tooth, which had been giving him problems. It presented a very nice challenge for the first thing in the morning, but he did great. He's a good patient, and I expect him to have a full recovery with no complications.
There's so many people that can't, afford to have it done, and so to be able to come and actually, receive dental treatment at no cost, it's just awesome. And the people out there, they're freezing, but they're like, we don't care. It's worth it. We appreciate it. And so I think that's the most rewarding.
Procedures today, we've done extractions, we've done some restorations, some decayed teeth. We've had 2 or 3 people that we've cleaned. We had one patient who thought she had a cavity and it was just buildup on her teeth, so we were able to clean her up and make her happy pretty easily, so she was excited about that.
I hope to save this tooth, but if I can, I have to get this tooth pulled that had a filling in it. I'm hoping that the doctor can tell me how, if I get this tooth pulled, to get a partial, because my son is planning on getting married next year, and I don't want to have snagger teeth.
We've had a lot of patients that have wonderful stories. They, just haven't been able to afford dentistry, so they've gone years with conditions that nobody should have to live with.
You guys ask me why I do this. If you can meet someone where they are at the most basic need, where does it hurt? And they point to a spot and you can tell them, I'm going to make you better. I'm going to do it today, I'm going to do it right here. And I'm going to do it now. I do this because I think we're made to serve. And if you have a gift, you have to share it with the world. We had some great stories today. A lot of people that were they needed us. There's 79 people that needed us today, and we were here for them. And it wasn't about compensation. It wasn't about it. It was about us meeting people where they needed to be met and taking care of those needs. We had one little lady, and she had a big cavity in her front tooth. She was just as sweet as she could be. basically the tooth is just gone. There's nothing left. There's nothing you can fix it, but it's going to take something more complicated than dentistry from the heart was going to provide for her. And she says, my son's getting married and I'm going to be snaggletooth. What am I going to do? So I don't want to lose my tooth. And I said, I don't want you to lose your tooth either. And I said, let me have your phone number. And we're going to call her on Monday and bring her in and just do the whole thing for her for free. So that's why I do what I do. That's why we did it today. And that's why we'll keep on doing this. Because it's worth it. It's necessary. And that's what we're called to do.
It's really great. I think it's very nice and generous of them.
It's a wonderful, wonderful experience so far. And that's usually not in the same sentence with going to the dentist.
Really? Really? I appreciate all they doing for us.
Thank you, because I know that y'all don't have to do this and you take your time to help others.
I really appreciate it. Without your help, I wouldn't be able to get the work done, and I thank you very much.
I'm very appreciative. It's been a little difficult, man. It's nice that people do this voluntarily. I really like that.
I really appreciate everything that y'all have done. It's been such a blessing. No idea, like such a blessing.
It was amazing, totally amazing. They completely changed my smile. Thank you for your time. Thank you for your blessing. Thank you for everything you did today.
This was the best experience I've had.
Oh, it's wonderful. I appreciate everything they've done, the work they're doing. It's really wonderful.
Thank you for everybody, the staff, the dentist. Thank you so much.
Thank y'all.
Appreciative to everybody who volunteered today.
And may God bless all of you all.
Any way that we can, help them and be a blessing to them is what we're here for. So it's nice to be a part of it, that's for sure.
I think we're making some people happy. Mission accomplished.
I like it.
So I'm happy. I'm happy. And thank God for Dr. Clinton. Yeah.
The patient got a smile in the end, so that was plus. It was awesome.